Hello everybody, we're live on YouTube and Facebook with our first live stream in our Erasmus Plus project Handle It. My name is Dirk Kratz and with me is Fernando Mendes. Hello Fernando. So, yeah, your microphone is muted. You have to... Yeah, hello Fernando.
Hello.
So, it's our first live stream in our Erasmus Plus project, as I said. It's because we have our second LTTA. It's a learning, teaching, training activity. If there wouldn't have been a Covid-19, we were allowed to travel, and now we would be in Croatia. But due to the situation, we're here online, but we make the best out of it. So we have our live stream, and now we will talk about our first day. So we have now our LTTA from Monday till Wednesday this week, and I hope everybody in our group from our organizations in our partner organizations will watch this now or after that. So, but first, Fernando, would you give us a small introduction of yourself and Eurofreya? You're the director of Eurofreya, a non-profit organization in Portugal, and a board member of EuroTC.
Thank you, Dirk, for this chance to be part of the project first and be coordinated by you and your organization. It's a pleasure. It's a very important project for the future of our work. As you said, my name is Fernando Mendes. I am clinical psychologist, and I am the coordinator of this Eurofreya. This is a non-governmental agency. Is in Portugal, and I belong to a network of other Eurofreyas in Europe. So this is a bigger network that we belong. But also I am here like the coordinator of a therapeutical community of the health minister in Portugal. This is a residential treatment with 12 and we can have 16 people in our treatment center. And in Eurofreya, we do a lot of work in the communities, the schools, in the parties. So we have a lot of work done, and you can see if you go to our website. And we are very happy to share with you and be with you in this fantastic journey. And it's unfortunately I would like to be in Croatia with our colleagues, but we hope it's very soon it's possible to share real life.
That would be great, and I hope that we can be with you in September this year. If it's allowed to travel and if the pandemic is getting lower, or we have restrictions for that to travel again. So thank you for your small introduction. I'm Dirk Kratz. As I said, I'm the CEO of a non-profit organization with the name Therapieverbund Ludwigsmühle. Is a kind of treatment association of inpatient and outpatient treatment centers, and we're specialized on drug addiction and treatment of drug addiction. So, Handle It is a project about new psychoactive substances and for best practice exchange between the staff members of our partner association, SU, Eurofreya, But now we have a other situation. We have a pandemic situation, which is changing the way we are working and the way the clients, the problems of the clients, and the way we plan our work to in our all day work. So there are many changes in that. Fernando, what would you say? What are the main changes for you in your all-day work of your organization?
Yeah. I can tell you since next year in March that we began to have this problem in Portugal. We began to deal with many difficulties to our center and the treatment center because we have this question about to get people inside and to have the control of the pandemics. We began to have some fear that the population has about the COVID and also about our groups because in Portugal, if you are a drug addict, the idea is that this is a kind of people that brings more problems than the health the problems that they have also. So the idea to put all these people in a center or in a community and to be out of the society. So we begin to deal with some difficulties to come here until last Friday, because last Friday we enter in a lockdown of the country. No schools, no go out, the work. I have to organize my team and have only a few people here in our community, and this brings several questions. First is that I have a limited intervention with our clients for the moment because I have no psychologist. I have no people that came here to do a lot of the animations that we have in the center. For example, we had relations, relaxations, therapies, and all these kind of things that are for the moment closed because we don't have people here to do this kind of activities. And I have also our clients that very unhappy with the situation. They are afraid of the COVID. They are always asking to know about the families and the friends that are outside. So the pressure is very high in the community. And I have not enough personnel to get or to respond to the situation. So we try to do some harm reduction, not treatment for the moment. Also, some difficulties to have some financial support for our communities. So we are struggling with a lot of difficulties for the moment. We try to do our best. The people try to respond to all the situations. But I tell you, it's not easy. And I know that not only in my center, this is very difficult, but I know that in other communities in Portugal, we are dealing with the same situation. So it's not very easy for the moment for us. But strangely, we have a lot of people that they want to come to our communities. I can tell you in the last week, I received more or less 15 asks for come to the center, but we don't have a response because it's not possible. So we are in the middle of the road, and we try to do our best and respond to the situation that we can deal.
Okay, you have many requests for your programs, your therapeutic programs, but you cannot you cannot take this requests.
First, because we have a small facility. This is not a very big facility. Also, because it's to enter here, they must go to make the control of the coronavirus to do the tests, and also they stay in quarantine to come here. And for some guys and some women, they don't want to go to quarantine. They want to go directly to us, but it's not possible. Otherwise, is that with half of the team, it's not possible to respond to all questions. And for the moment, as I said, is I'm do harm reduction, but I don't know if this treatment in the sense that we can have psychotherapists and all this kind of support. That's not possible for the moment.
Yeah. It's not possible to do this these harm reduction projects as you do it in the nightlife. One member said in our round just before this live stream that nightlife projects, they need nightlife to work, and now it's not possible. Yes, for us as treatment centers too, it is a difficult situation. It was a difficult situation, but we in April last year in Germany we were in fear that the therapeutic chain or the treatment chain will collapse, because every detoxification facility has closed because they needed the room for COVID patients, or there was they wanted it. The place stayed free for patients if they come, so they ended the detoxification for many people, and they couldn't start anew. And if there are not a detoxification, there will not be a treatment, a rehabilitation treatment after that. So they needed, or the addiction care in Germany needed a detoxification, but it has ended for about 6 weeks. And that was a very big problem, because there were no patients, and so we were in fear that this treatment chain collapse. But it in May there were we had some places with some solutions for that, so we're very happy about that this problem was not so big as we thought in the first weeks, but it was a big problem for us in the first weeks of the pandemic. And then we had many clients from jail, because in Germany it's a possibility to make a rehabilitation instead of punishment if you committed a drug-related crime. And that's possible to go to rehabilitation. And so we took many clients from jail, and that made something out of our treatment centers, because the social situation was another with these clients from jail. It's a little bit jail-related social structure then. So, and that was a problem too. So we have many drugs, and like NPS, it's a big NPS, a new psychoactive substance problem in jail in Germany. So the problem switched from jail to us more than in a normal time, and that's till today. It's a bigger problem. So yeah.
But we have the same in Portugal when we talk about this disintegration situation, because to come here to our facilities, you need to go first for one the disintegration. Sorry for the English, and they closed also the facilities. So for I don't know, 1 month or 2 months they are closed. with no people to go there and to come to our facilities. This is one question that we share with you. Another is that the parties, since last year, since March last year, we have no festivals or parties, but we have official parties. But we have a lot of people that go to those particular parties that they have and they do with their friends. And this is a problem for us because we have noticed, because we have other projects in Portugal that lead with nightlife. And we know that here near Coimbra, in the region of Coimbra, a lot of small and middle big parties are going without our knowledge, without official knowledge, and this also means a lot of problems. Alcohol and drugs that are used in these parties, and NPS drugs that are using. So this is a problem, and I think for the future will be our next clients that will come to us for the future.
Yeah. Do you think these parties are not in public, so that's a problem? It is right? Did I understood it right?
And private parties.
Yeah.
They're not official.
Yeah.
They can meet in the middle of the field, or they choose places that are that the people don't know to go there, and you can find I don't know 1,000, 2,000 people there in the night, in a lot of alcohol and NPS drugs, other drugs. So we begin to have this preoccupation to be aware of the situations for the future, because we think that some of the people that go there maybe are our next clients in the communities.
Yeah, that could be. Yeah. So, what do you think after the pandemic? If there are solutions? No. First, you said there are many difficulties with the fundings for the project. Is that right? What do you say to your government or your politicians? What could they do?
For the moment, I think they are only the head on COVID. They don't think nothing else. The important thing is COVID and treatment and hospitals. We are always telling that it's important to look to us and to look our situation. But I think they are not to be very open to our situations. They think it's okay, they are there, it's no problem. But the rest is more important. Hospitals and people that are dying in the hospitals is true. This is in Portugal and elsewhere. And they don't want to know for the moment for us. And we are waiting. But we are struggling every day to ask for masks, for example, to ask for to clean our hands, small things that are important, and try to. This is another situation that with our population now in our communities, they have now very serious problems of health, and to try to find a doctor to attend them and to ask for the situations is not easy. We try to have contacts with our national system and try to have some responses, but it's not easy. So it's hard times to us.
And what about the tests, the antigen tests? Do you have someone of that? Because in Germany we have tests, but we don't we are not allowed to test if we are not a medical professional. So you have to be a professional to be allowed to test, because the tests are not common. It's not for the common society. it's a medical product in Germany. So yeah, only medical professionals allowed to test.
No, this is another question we are asking since last year to have test our people, not only the technicians but also our patients, and the answer is no, because we are not a risk group. So no answer. But yesterday uh, we we begin to do vaccination to our people, to the technicians, and by a very opportunity that we have yesterday, we begin to vaccination our members of our teams. So this is the main step that we did for the situation. And I hope for the future it's possible also to vaccination our clients. But it's important that they begin to do the vaccination of our team. But it was an opportunity that runs, it's from the sky. It was a miracle to have this opportunity. So, but for the tests, no, they don't have tests. It was not until now possible to test neither the team, neither the clients.
Yeah, I think there's so big holes in the supply chain for for stuff to for hygienic stuff and something. It's also the situation here, but we have many masks, and we have a kind of tests. We don't have enough vaccine. I think that's the same situation in all over Europe, and I hope we will have a vaccine this year for us, for our staff members, and especially for our clients. So. Yeah, let us hope the best. For me, I would say to the politics to make a better online infrastructure in Germany. It's very hard to reach some clients if they are not in our facilities, because they have not a mobile phone connection. It's due to the connection. It's not a good connection, and it's very expensive for them if they are in a bad situation, in a bad social situation. So it's very hard to connect to the internet because it's expensive. And mobile phones are not common. They are too cheap or too old, and they cannot connect to the internet or the online tools. And over that we connect with the people. It's a big problem. So we have the same problem in our schools, where the people, the pupils, who are not in a good social situation, they do not have the mobile phones or the technique to stay in contact with the school. So and
we have the same situation. For example, in here in this therapeutical community, we don't have internet. So I have the internet for the computers, but it's not possible to use for a meeting. So it's very difficult. We use the private one to do this kind of things. So it's not easy to, for example, because one idea is to contact the families or the friends through the internet, and this is not possible, only by phone. And that's for the people, they would like to see the people, the families and the friends. It was easier, but this is the reality. It's not possible, and for the moment we don't have I don't have this idea that they could resolve the situation in the next month. So we deal with, or we do what we have to do with to do the things. Another thing is also the schools. They closed the schools last Friday, but some people would like to have online classroom, but they say no um, because they don't have capacity to have all the schools in Portugal linked to the school. So this is a heavy problem for us for the moment. Maybe some colleges have this capacity because are more powerful, but for the main NGOs or the people that work in this field, hard times.
Yeah, as far as too. But our schools are a kind of open. Nobody knows how it's really open. It's a kind of emergency status in our schools. If you don't can be with your children in your home, you can give it to the school, and you have some emergency possibilities for that, but that's not really a solution for that. So and the other problem is that, as you said, what do we as NGOs with our staff members? We have to do work with our clients in some way, and that's another problem for us, and that's not really a solution.
I think one of the possibilities that we can do at the European level, it was to be part of a task force of NGOs, networks, for example, EuroTC, that could talk in the Parliament, in the European Parliament, and to defend our situation, because this is important that the people, they don't realize our difficulties. So we need to be together, and this could be a very important opportunity with EuroTC or with other peoples, and maybe to go to Brussels and to explain our situations. Maybe this could be to have some impact. Because at the national level, they are focusing only the treatment is hospitals, and nothing more. So this is strange. This is the situation. So
I think that's a big message on the end of our live stream. We should take that and give it to our member group after that. So thank you very, very much, Fernando, for this live stream, for this discussion. It was very great. It was a pleasure to discuss with you. And so, out there, if you have questions for us, for our treatment centers, for our partners, if you have questions about the COVID situation or the NPS situation, just follow us here on Facebook or YouTube. Just write a comment and follow us. So thank you very much, Fernando. We will see you in Teams.
Yeah.